This city never sleeps. I hear the people walk by when it's late.
Hey guys, your favorite nurse educator here, Nurse B. Welcome to another interesting episode of Health Education series. Today we'll be talking about miscarriage or spontaneous abortion. Miscarriage can also be called spontaneous abortion. Miscarriage is the spontaneous, non-induced loss of pregnancy before 20 weeks of gestation without any form of medical or surgical measure to terminate the pregnancy. This usually happens within the first trimester, that's the first 3 months of pregnancy. It is estimated that over 1.5 million miscarriages take place in Nigeria every year, which is such a huge number. This miscarriage has both physical and mental effects on the mother. But it could happen for a variety of medical reasons which could not have been under your control. Now let's consider the possible causes of miscarriage. It could range from a major trauma, where the first 3 months of pregnancy is a very sensitive one. So if you're involved in any form of trauma, maybe a road traffic accident or a fall that has an extreme effect, that could terminate the pregnancy. Or an emotional shock, something very extreme that shocked you emotionally. We talk about lifestyle, like drug users or alcohol abusers, and underlying disease condition like uncontrolled diabetes, severely high blood pressure, uterine abnormalities like abnormalities in the womb. For example, fibroid. Fibroid is like a tissue, a non-cancerous growth or tumor that is in the womb. When there's fibroid, there's limited space for the baby to implant, so that could lead to miscarriage. Or scalding and adhesions. We talked about scalding and adhesion in our previous video, where we talked about if someone has had several times of dilation and curity, what we call D&C, some part of the womb could be scalded, so that could affect the functionality of those tissues. So the baby, each time it wants to implant, because there are scars, it's possible if it does, it could fall off or it doesn't implant at all. So that could also cause miscarriages. There are also genetic or chromosomal causes. The chromosome holds the gene which carries information that are passed from parents to offspring. Now, one set of chromosome is provided by both parents. So some chromosomal abnormalities like intrauterine fetal demise, where the baby or the embryo grows for a period and then stops even before you could have noticed that you have symptoms of pregnancy. We also have what we call molar pregnancy, where the chromosome is provided by one parent alone, which is not supposed to be so. Certain people are at risk of miscarriage, especially people that are of older age, got pregnant at an older age. Those people are at risk of having miscarriage. Another possible cause of miscarriage is taking of certain drugs. During the period of pregnancy, it is a very sensitive one, that it is not the best time to self-medicate at all. It is usually advisable that you seek medical attention before consuming some drugs, because it is noted that some drugs have severe adverse effects on either the mother or the baby or both. Drugs like some antibiotics like chloramphenicol, levofloxacin, ciprofloxacin, sulfonamides like sulfamethazole are known to have adverse reactions on the baby during pregnancy. Or even non-steroidal anti-inflammatory drugs, pain reliefs like ibuprofen, also have effect on pregnancy. So it is not the time to self-medicate at all. The slightest anti-malaria drug that you take when you are not pregnant could be contraindicated during pregnancy. So it is not advisable to self-medicate that period. It's not even advisable to take medical advice from people that are not professionals, because that period your mom's opinion would want to count, your grandmom's opinion would want to count, other people that probably had been pregnant before would want to make recommendations on what you should take if you have any form of symptoms. You can't be consulting those people because you never can tell. You could be sensitive to whatever they're going to prescribe for you. So it is the best time to seek medical advice. There are several types of miscarriage. one of which is threatened abortion. This occurs when the pregnancy is complicated by abnormal vaginal bleeding. It could involve symptoms that suggest that the pregnancy is threatened or there is a risk of miscarriage occurring. The patient might experience symptoms like light to heavy vaginal bleeding, mild abdominal cramps. Threatened abortion doesn't mean the pregnancy has been terminated or the miscarriage has occurred. It could just mean that there is a tendency that the miscarriage will occur. It could be from a very rough sexual intercourse or trauma or ectopic pregnancy. Ectopic pregnancy is when the pregnancy occurs outside the womb. It could also be from infection. The treatment for this type of miscarriage is usually bed rest, where the patient is expected to rest, maybe stop work, stop any form of very strenuous exercises or strenuous work for a period of 6 to 12 weeks. Avoid sexual intercourse until the pregnancy is up to 12 weeks, or if there's a medical cause, it could be treated medically. Another type of miscarriage is inevitable abortion. Here, the cervix is dilated or opened. The cervix is like the opening to the womb. So when that part is already opened, it means the miscarriage is inevitable. It's unfortunate that the miscarriage cannot be reversed. So the only treatment measure for this inevitable abortion is to expel what we call suction D&C, suction dilation and curettage, where they would have to remove all the product of conception. Complete abortion. This occurs when the abortion or the miscarriage has already taken place. So there is no need for any treatment. All the products of conception, all what was in the womb, the baby, the tissues, the placenta, every pregnancy tissue has been expelled from the womb. So there is usually no treatment for this form of abortion because it's complete. Incomplete abortion occurs when an abortion or miscarriage took place, but there are still retained product of conception in the womb. This could be part of the baby, could be part of the placenta, or tissues that were in the womb. So these tissues are retained, and if they are left there, they could cause an infection. So the treatment measure for this type of miscarriage is still to do a D&C, where the womb will be dilated and opened, the cervix will be opened, and then to be curated, whatever was in the womb will be expelled so it doesn't stay there to cause an infection. The period of pregnancy is very, very sensitive. So to avoid any form of complications, it's advisable that you seek medical attention. If you notice anything that is not normal, call your doctor or call your health provider. Go to the hospital. Don't resort to self-medicating if you see any symptom, because you might only be complicating what is already taking place, because when you eventually get to the hospital, it could be regrettable that maybe it's the drug you took that is complicating the medical condition. The psychological effect of miscarriage on the mother is usually quite much, or most times you don't have control over the cause of the miscarriage, so you don't need to beat yourself over it. This is where we'd wrap it up on this session of health education series. Do well to subscribe, share the video with your friends and family, click on the subscribe button, and turn on your notification bell to be notified each time I post a new video. Thank you, and bye for now.